Most of you think of me as a speech teacher, but what my official name is I am a speech language pathologist. I think I might have told you that when I talked to you before, but in case you weren't listening, I'm going to tell you again. So what we're going to do today is I'm going to tell you about what it's like to be a speech pathologist. Now you might think that I'm going to tell you everything about the schools, but I'm actually not, because a speech pathologist can just choose the schools as one place that they want to work in. And the other stuff that we can do is absolutely really cool. So I'm going to tell you about that, plus it's cool to be in the schools too. So that's what we're going to talk about today. First of all, the main thing that speech pathologists do is our career is to work on communication problems that anyone has, and they almost always come from something in the brain. Does that make sense? Like we can't walk without our brain telling us to walk, right? Well, you can't talk without your brain telling you to talk. You can't listen without your brain telling you to listen, okay? So when a speech pathologist sees someone, they usually have a problem, not a problem, but there's usually, they need to retrain their brain how to do things correctly. Now, a lot of you know that one thing I work on in the schools a lot is just kids that might have problems saying a complete sentence or saying speech sounds. And some of you, probably a lot of you, used to go to the speech teacher. It wouldn't have been me when you were maybe over at Porter Lakes. Maybe you went as a preschooler to speech therapy. It's very common. People go to a speech pathologist to work on using good sentences and to work on clearing their speech all the time. Just like you might go to someone to help you with your math. Well, in the school system, that's mostly what a speech pathologist does. I'm a teacher, but instead of teaching reading or math, I teach speaking, using correct speech sounds, and I teach language, which is using correct sentences and making them correct, like making sure that your noun matches your verb and that you put an ED on the endings of the words. I also work on vocabulary, things like that. Everything that has to do with communication. Got that so far? Okay. I don't know how I wanted to be a speech pathologist, but guess how old I was when I decided to be one? 14? I was in 4th grade. I had never seen a speech pathologist before. I mean, maybe I did, but I don't remember. I had never been to one. I had no idea what one did. Somehow it just came to me. I don't know. Maybe watching Sesame Street or something. I decided I wanted to be a speech pathologist. I never changed my mind. I got done with high school. I went immediately to Purdue University. To become a speech pathologist, you need 2 degrees.
Timmy Kermiani, please come to the front office for dismissal. Timmy Kermiani to the front office for dismissal. Thank you.
Okay, so you need 2 degrees. First you go after you graduate from high school, you go for the 4-year degree that a lot of people do, and that's to get your bachelor's. So my degree is from Purdue University in speech and hearing sciences. So I have a bachelor's degree in speech and hearing sciences, which is why you guys might remember or recognize that a lot of times when your hearing gets checked, I do it because I have a college degree that taught me how to check hearing. Okay? Then, after you get that degree, you have to go on for your master's degree in order to be a speech language pathologist. So then I stayed at Purdue and I went for 2 years and I got my master's degree in science for speech language pathology. And that's when you decide if you want to become an audiologist and work with people that have hearing problems or that are deaf, or you decide you want to be a speech pathologist. There are some people that do both, but that takes even more college to get that done. So that's what I did. There are 3 areas that I work on, and I touched on 2 of them, but the third one's going to be really interesting. One thing I do is I work on speech. Now, as you know, that's speech sounds. You guys all know what that is, right? Okay, like using S's correctly, using R's correctly. That's one thing I do. The other thing I do is I work on receptive and expressive language. If you listen to those vocabulary words, receptive, it means to receive. So I work with people on how to receive words that are given to them, like following directions or understanding vocabulary in the sentences, and if they can understand what's said to them. Then there's expressive language. Expressive language means Expressing yourself. So that's not listening. What's that doing? If I'm expressing, I'm talking, right. So those are what we work on. We work on speech. That's one group. Then we work on language. Expressive, expressing yourself, receptive, receiving language and understanding what it means. Then the third thing that we work on, I'm going to show you. And when sorry, I'll get back in my spot. When I went to school, which I have been a speech pathologist for, are you ready for this? Don't fall out of your chairs, and I mean seriously, don't fall out of your chairs. 29 years I have done this. When I went to school, this area that I'm going to tell you about, sit up guys, was not even considered a part of what we do. And it's called dysphagia. And what dysphagia has to do with swallowing. So what I would like everyone to do is we're going to swallow. And I'm going to be the only one that uses a spoon. So if I were going to eat, I have to swallow, right? If I don't eat, what's going to happen?
You die.
I'm going to die, right. So if I were going to eat, I would put this in my mouth, and what do my lips have to do? My brain has to tell my lips to circle around the spoon. That's the first, actually that's the second step of swallowing. Guess what the first step is? Your brain, I'm just going to tell you, your brain thinks or smells real food. And if that happens and you're shopping, do any of you get saliva going in your mouth?
Yeah.
That is the way the brain tells you, I am preparing this body for eating. So, you think about eating or you smell something steak, like over by the mall, and you start salivating. The saliva is the step one of swallowing. Then, step two is your mouth has to surround whatever it is to get the food into your mouth. Speech pathologists call that food a bolus. It's just a technical term I was trained on. It's called a bolus of food. So you got to get it in your mouth. Then your tongue has to get that food. If it's applesauce, it goes all around your mouth. If it's steak, you got to chew it, right? So your brain has to tell your body, chew that up, gather it together, get it in the center of the tongue, throw it to the back of your mouth, but don't throw it too fast, because if it goes down your throat and you don't catch it, the muscles don't catch it, what if it goes down the wrong pipe? Have you guys ever had food go down the wrong pipe?
Yeah.
Guess what pipe that is? It's the pipe that leads to your lungs. And so if there are people that are having problems with their muscles on swallowing, then that food can go into their lungs, then you get pneumonia. So there's something called the larynx in the esophagus, and the larynx has to know to stop the food. It blocks off the lungs, and it opens up the esophagus that leads straight to your stomach. That's how we should chew food. Well, 30 years ago, no one really was in charge of that. And then they got to thinking about it because people that have strokes, like very elderly people, or babies who are born premature and have problems swallowing because their muscles aren't developed well enough, they need to eat or they're going to die, or they're going to have food through their sides. So they said, who on earth could be responsible for this new science called dysphagia, or swallowing disorders? Well, guess who knows all about the tongue and the lips and the mouth and the throat? So that's what speech pathologists do too. They don't do that in the schools because you don't need to be able to swallow in order to learn. So that's why you never see us feeding people in the schools. But if you go into the hospitals, they are doing it there, okay? And so that's our third area that speech pathologists do. So now we're going to do one more thing. Ready? Here we go. We're going to go ahead and swallow. So I'm going to put this in my mouth. Go ahead, round up the saliva in your mouth. Push it to the back. Swallow. As you swallow, did everyone's trachea block off the airway?
Yeah.
Okay. So none of you need dysphagia training. You're all good. Does that sound good? Okay. In the schools, we work on speech, we work on language, but there's another group of people that I wanted to tell you guys about because I know you know it, but you might not know their names, okay? They are called people who have autism. Have all of you heard of autism? Okay. Guess what the very unusual thing, there's a whole bunch of things that are unusual about autism. First of all, autism, its actual name is a language disorder. So that is exactly the type of people that I know how to work with the most. The other thing about autism, because it's a language disorder, people who have autism, bless you, have problems with receptive and expressive language. And now we're not going to name any names. I know if you guys know people with autism, that's fine. But let's not say any names in here because that would not be fair to those people. But if you know people with autism, they use like one word or short words, or the teacher might tell them to do something, and not only do they not do it, but they might fall to the ground and do what looks like a temper tantrum. Guess what? That's not a temper tantrum. It is them saying, I want to tell you something, or I'm not understanding what you're asking me, and it's getting me really frustrated. I don't have the ability in my head to put all those words together, and the only thing I know how to do is to drop to the ground and throw a fit. Or the only thing I know how to do is to hit someone, okay? People with autism might do that. They are not throwing a temper tantrum. But the amazing thing is that there are so many people that have autism, or what's called Asperger's, which is very high ability if you have autism, that they might be all around you everywhere you go and you don't know it. They might be at Walmart with you and you might see someone getting in a fight with someone and you'll think, oh man, someone better come arrest that person. They might be a person who has autism. So autism is growing more and more and more, and it is going to continue to grow as something that is just happening that no one understands it. So it's really important you guys understand that. But the other thing is, do you think I am ever going to not have a job? No. Just people with language problems, for example, people with autism, are always going to need someone to help them. Because that person who's throwing a fit on the floor, or that person who's hitting because they can't say, I really need to go to the bathroom, and I know I'm going to have an accident if the teacher doesn't let me go to the bathroom. You know, when they can't say that, it's very frustrating and overwhelming for them. Also, there's something about autism, and this is very important. If a room is too loud, like when you guys are in the gym, or if you're at the movies and the movies are blasting, there might be someone who is totally sitting there and doing fine, and all of a sudden they just jump up, or they throw a fit, or they get angry, or they run out of the room. It's because they can't process all the voices and the noise that's coming in, which is language processing, and it overwhelms them, and they do the only thing they can do, which is escape and leave or fight. Isn't that fascinating? And then I think about my job, and I think, wow, I get to take people who have no language, and I get to help them learn how to communicate so that they can communicate not just in their classrooms, but they can communicate with their families and their friends, or the police, or their doctors, and then they have better lives. So my job is incredibly cool. I am going to show you a picture of a little boy. He's a preschooler, and his grandma takes care of him. He was identified with autism. The speech pathologist in this is showing the grandma how to play. Now, I know you guys see me walking down the halls all the time with toys, right? And I'm sure you probably think, are they paying her to play? Well, actually, they are paying me to play with the kids that need that. Now, those kids that come to speech, well, sometimes we play games a lot too, but that's because you can't work on R sounds or S's for a half hour and just go So I do play games. But you'll see in this picture, she shows the grandma how to take turns. And in the beginning, when the grandma does not take turns with this preschooler, he doesn't say a single word. Then all the speech pathologist does is say, okay, watch, grandma, watch what happens if you take turns with him. And then you'll see he starts counting, and and he starts talking. And so that's one thing that we do. So here we go.
Blessed with him, and he is on the autism spectrum. I'm Renee Dunn. Marcus, look, I'm Marcus's grandmother. Look. Car? You have a car? He likes playing by himself, and whenever you would sit down with him, he would kind of move away. It's not the game. And he is getting very
People with autism do not know how to play with other people. They have to be taught.
His grandmother was autistic while his parents worked. When I first started working with Marcus,
She's a speech
he
pathologist.
was not talking, not saying any words. He had lots of babbling. He wasn't very interested in playing with others. I'm Jenny Sharpless. I'm a speech language pathologist here at the Kennedy Krieger Center for Autism and Related Disorders. The number one strategy we're going to work on today is just tuning in to what he's interested in and imitating him. So show me how you normally play at home.
Okay, well, the first thing we would do is we would take them out. Now, if he didn't immediately take something, then I'd give him something.
So he knows the shapes. He knows where they go.
Great, so he was really good at that puzzle. But the one thing that I noticed is that he's playing and you're watching. I want you to be able to be his play partner. So what was he doing with this puzzle?
He was picking up each piece and putting it in.
Yeah. So then you will take your turn and do
So I
it.
can do one and then I'll do one.
Yes.
Okay. Yeah, I'm gonna put one in. Two.
He started counting.
Already the look of your play has changed. You were playing together. It looked like you were taking turns. It already looked more fun. One thing is we talked about not asking a lot of questions, not using a lot of generic type language, but looking at a toy and thinking about what's the most important vocabulary we can pick out from this toy. Like just looking at this simple puzzle, what are some vocabulary?
So then they're talking about vocabulary. Now, did you guys see how that happened? Yeah. And he started saying words even when they weren't talking to him, all because the speech teacher just said, the speech pathologist said, show him how to take turns. That's something you guys can learn when you're out anywhere, even on the playground here. If there are kids that have autism, or that even you think, boy, they have a problem playing with other people, you would be helping them. You would actually be changing their life if you just went up to them and helped them. If they seem overwhelmed, you just go, hey, it's okay, take a deep breath. And that's a way you can start helping people with their communication skills, just being in 4th or 5th grade. Isn't that pretty cool? Are you guys surprised about all of that? Did you know the statistics right now say in the United States, about 1 in every 30 to 40 people have autism, or some form of it, which is amazing. So, let's go on now. That's in the schools. That's pretty much what I do in the school system. But there is also the hospitals that we talked about. So, I'm going to show you, because we're already starting to run out of some time, I'm going to show you a picture of a premature baby, okay? And you're going to see this baby. I don't know the history exactly, but I do know he or she, I think it's a girl, was born without the ability to swallow. A lot of times that happens when babies are born premature. The first thing that doesn't develop are their lungs. And this is something else I forgot to tell you. When you swallow, the moment that you're swallowing, you quit breathing. So if it's a baby that's having heart problems or lung problems, they can't coordinate all of that stuff that needs to go on. So this baby that you're going to see does not have the ability to drink from a bottle. And think about that. A baby that's having problems, you guys know how you had to gather your saliva? Imagine having to suck around the bottle nipple and pull the milk out. and then the milk goes all over your mouth, and then you got to get it together. And this is a little baby that's still supposed to be inside the mother, but it got born early. So this speech pathologist is taking away that part. She's not giving the baby a bottle to drink out of. She has someone helping her. She's using a tiny little syringe. You know how when you were younger and you had to have Tylenol, your mom would give you like that much Tylenol liquid and squirt it in your mouth? That's the bolus, or the food that the speech pathologist is giving. Then they stick a pacifier in, because a pacifier, naturally a baby's instincts are to suck on a pacifier, and so if she's sucking then, she doesn't have to get the food out of it, she just has to get it together in her mouth and get it down. So this is just a short clip, and I want to show you a speech pathologist working in a hospital. Isn't she sweet? She has oxygen on because she's having problems breathing. The assistant removes the pacifier. That's the speech pathologist. It looks like she has about that much of a bolus of formula. They're waiting to watch, they're watching her throat to see if she's going to swallow. That's what they're waiting for. Okay, now she's going to put a little bit in. And then they give her the pacifier again. And then they're watching her throat. Sometimes you put your hand on the person's throat and you wait till you feel the swallow. Sometimes it requires using a flashlight and having the person open up their mouth so that you can watch and make sure that everything's out of their mouth. Now again, imagine, they have probably been working several days to get to this point. How on earth is that baby going to eat? Right now she can't. She won't be able to eat until this speech pathologist works enough with her to be able to swallow real food. It probably will happen. It almost always happens. Sometimes it doesn't, and they have to be tube fed for the rest of their life. Do you have a question about that?
Not really, like, about the video. What year was that?
What year is that?
Is that this year?
No, it wasn't this year. I don't know when that was. Okay? But so in the hospitals, we work with people all the ages. Just a minute, okay? We work, how late can I go?
About 5-10 more minutes.
Okay, okay. Sorry guys, I'm running over, because you know why? Talking is what I do for a living, so I tend to talk a lot. In the hospitals, we work with people all the way from brand newborns. I have even heard they have started working with babies still inside the mothers on some things, especially on swallowing. But we also work on all the way up to senior citizens. Senior citizens are in the hospitals a lot because a lot of stroke patients have to be hospitalized, a lot of head trauma. If someone's in an accident or a motorcycle accident and they weren't wearing their helmet, when they get hit on the head, it's basically the same thing as a stroke, and not always, but what a stroke is when your brain bleeds. So a lot of times people just have it naturally, especially if they're older, or if you're in an accident and you have a brain injury, that can cause bleeding on the brain. Has anyone ever known anyone that's had a brain injury or a stroke? And did it affect, keep your hands up, if it affected the way they talked? Or were able to listen? So a lot of you know those people. It might be your grandmas and grandpas. It could be, I have worked with people that are 19 that have had accidents or strokes. And so who gets them back to talking? It's us. The last video I want to show you, wait, let me make sure I'm going through everything here. Oh, let me tell you, before I show you this video, the other place that we can work is private practices. If I wanted to, I could go buy a building, I could get myself some basic equipment, I could put my sign on the door that says I'm a speech pathologist, and people come to me, and I can work on anything I want. So I could own my own business if I wanted as a speech pathologist. I could choose to work in the schools, which is what I've done. The reason I did that is because I have kids. And my youngest is going to graduate from high school right now, but it was best for me to work in the schools when my kids were in school. So that's why I do it here. The other place that I love to work is in nursing homes, because a lot of those people have had strokes or Alzheimer's, where they no longer can remember who their family members are. And that stuff, you know someone that has that. And so those people see a speech language pathologist to help them. We can't help them recover like they always were. But I used to do home health, where I would go into the homes of people, and they had just come home from strokes. They couldn't talk at all. They couldn't eat at all. And by the time I left there, I can't even remember a single patient that ever wasn't eating and able to talk at least significantly better, that they could communicate with their families. And they can be very, very, very handicapped by the inability to talk, okay? This last one I'm going to show you. It's a picture of a man. I don't know this man. I just found this on the internet, but I have worked with people like this. He's an elderly man. You'll see he is very sweet. He looks like a very sweet grandpa to me. I am positive he's led a full life with a wonderful job. I'm positive he had a wife. I'm positive he had children. And then he had a stroke. Now, strokes can sometimes just affect the way you walk. They can affect the way you talk. They can affect the way your arms move. It just depends where it happens in the brain. And we just don't know that, how that is for individual people. Same deal with people that are in accidents. But if the stroke happens on the left side of your brain, there's an area called Broca's area, and there's an area called Wernicke's. And if it happens in that area, that's where language takes place. That's where the brain processes all of that. So if the stroke happens over here, or if the brain injury happens over here, they're going to have problems talking, okay? So you have to listen really closely, because the speech pathologist is going to say, what did you do today? Now, you would think that he would answer what he did, except that he has receptive language problems, which means he can't receive the words and process them in his brain and then express himself with expressive language on what he really means to say. So she's going to say, what'd you do today? And he's going to talk about a boat, okay? You're going to want to laugh. I'm telling you, you're going to want to laugh. But what I really want you to do is be very mature about it and think about how his life is impacted when he can't even say to his wife, I love you. He can think it in his head, but he can't say it because his brain won't let him understand language and express language. And then at the end, it's really sweet the way he says goodbye to the speech pathologist. So you just have to listen, okay? And you'll see what he does. Normally we would say, like, have a good day, but he says something a little bit different, and so really listen to it to see what it is. And like I said, it might sound funny, but really, and I'm not joking, you guys, it's a tragedy. It's a tragedy when these things happen. And that's what I love about my job, is that I have always gone in, and I have never, ever had a person who was in bad shape after something happened to them. And when I was done working with them, they weren't better and communicating. It almost always goes up, you know, their ability. And then you leave knowing this person, I had one lady, her whole goal after a stroke was to eat French fries. And she was eating French fries when I was done working with her, from McDonald's. They had to be McDonald's French fries. And so again, this guy might make you laugh, but I hope it sort of makes you want to cry, because it's very sad. And it's called fluent aphasia because he's very fluent. He can talk very easily. She's going to say, what'd you do today?
Hi Byron, how are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talk with the people for them over there. They're guiding for them at the moment. They'll save in the moment. He'll have water for soon. For him. Good luck for him.
So we're on a cruise and we're about to
We
get
will
to June.
sort right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
She tries to draw him back to what were we doing?
They don't show a darn thing.
With the iPad that we were doing. Like here?
And he's thinking,
I
he knows he's got it
changed
wrong.
For me, and changed hands for me, and with Kathy. I would talk with Donna sometimes. We're out with them, other people, I'm working with them. I'm very happy with them. This girl was really good and happy, and I play golf and hit other trees. We play out with hands. We save a lot of hands on hold for people, for us, of their hands. Of what you get, but I talk with a lot of hands for hands. Sometimes. I'm not talking any more than saying.
All right, thank you very much.
Thank you very much. I appreciate it, and I hope the world lasts for you.
Thank you.
I hope the world lasts for
Have a
you.
good day.
Isn't that beautiful? Now, he probably was not talking nearly like that when he first had his stroke. He has probably been doing speech therapy with that speech pathologist for a very long time. And so this is doing well. She will probably be able to get him even further. And there's a whole bunch of things that we do. We use communication devices, we use pictures. There's a whole bunch of things that she can do to make life better for him. But that's what we get to do. So, let's see what I put on my last page here. I can't remember. Being a speech language pathologist is incredibly rewarding. It never gets boring. It's a very secure job. You do have to go to college and you have to be good at doing your work and getting good grades. It's very difficult to get into. The cool thing is, Ball State has a program. Purdue University has one of the best programs in the nation. When I graduated from there, I got about 45 offers from around the nation to go to work for them. They never laid eyes on me. They just wanted me because I came from Purdue University. So that's a little toot for Purdue. But you don't have to go there. But the main thing is, you must be the type of person who is patient, because you're going to get frustrated real fast with someone who's speaking like that. Or it's going to take 2 hours to get 1 ounce of formula down a baby's throat. You have to be a patient person in order to be a speech language pathologist. So I will take 3 quick questions, and I'm going to choose people that did not raise their hands before. Okay, what's your question? In the school? Speech language pathologist? I remember I was in 4th grade, and I don't remember why. Somehow I heard about it, and I just decided it's what I wanted to do.
When they have problems with eating, do you eat pureed food, or do you just...
There's something called a cookie swallow, and you go into the hospital, and the speech pathologist is there, and the doctor is there, and through like an x-ray, they swallow different consistencies of food, and it's water, applesauce, like a cookie texture. That's why it's called a cookie swallow. You must have a grandparent that's had that done. Yeah, you think so? And then we can tell, because sometimes it'll go into the lungs, and then we know, okay, they are not ready to swallow something as loose as applesauce. So this is a person that needs to eat tiny pieces of beef, because if it's in a ball, it'll go down to the stomach. So that was a really good question. And they usually can improve, usually. Also, you can do things like you teach them to turn their head, or you teach them to look up, or they have to swallow 4 times. We know that that's a patient when we watch the cookie swallow. If they swallow 4 times, they're able to clear everything out of their mouth. And so then that just becomes the rule. Yes? Oh, goodness. Hundreds and hundreds of students, just hundreds. And nursing homes, I've probably worked with 300 or 400 people in nursing homes. I've done home health. I've just worked with many, many, many students. Yes?
How long does it take for you to get your degree in speech?
That's a great question. It takes 4 years in a typical school to get your master's degree, and then or to get your bachelor's degree, and then when you specialize in speech or hearing, that's usually a 2-year program. Okay, 2 more? Yes.
Like, it's not really a question, but
very nice of you to say that, because it is. Wasn't it very touching? To me, it's not hard at all. I love to do it, and I love. I had a teacher in a different building that told me that her mom has Alzheimer's right now and lives in another state and is having problems. And I said, let me get stuff together for you. I love just knowing that I can help them make things better because I'm trained to do it. Okay, last question. Because when I was raising kids, I didn't want to have to put that many hours into it. I liked it in the school system that when they were off for school, I was off of school. But I also like doing home health. And also, the nice thing about this is any of you who want to be stay-at-home moms or stay-at-home dads when you get older, but you still want a degree, because we are needed so badly, we can get a job anywhere we want and we can set our own hours. So currently, you guys don't see me here very often because I go to all 4 of our buildings in Boone Grove, but on Wednesdays, I don't work. I never have worked on Wednesdays. I used to only work 2 days a week. And then most places, they'll say, sorry, we're only hiring full-time. But speech pathologists are needed so bad in so many different areas that now they'll take whatever I'm willing to give them. So, okay, guys, I'm sorry, but we have to go. However, you guys know that whenever I'm in the halls, you got to go where you're going. But if you ever have a question for me, just feel free. Or ask your teacher. If you have really significant questions for me, ask your teacher, and I would be happy to have you come to my speech room and talk to me about it, okay? All right, thank you.